Our lab, our research basically is on the cell biomechanics research, and we look at how cell responds to mechanical loading. So more specifically, we're looking at the musculoskeletal system. We ask a question that when under loading, for example, when you have exercise, how cell in your body, in your bone, in your muscle, will respond to this different kind of loading, and how this response will affect the disease progression. For example, bone metastasis, so for example, osteoporosis. So that's pretty much what we've been working on in the recent years.
So my research is focusing on developing a new device which can capture the circulating clonal plasma cells in the blood of the patients with multiple myeloma, which could lead to a new ways to monitor patients while in remission and assess their risk of the relapse. When these myeloma cells leave the bone marrow and enter the bloodstream, the patient may be at an increased mortality risk. However, these circulating multiple myeloma cells are difficult to detect, especially at low levels. So I am conducting research with our hospital collaborators. Firstly, use a computer model to design a microfluidic device containing tiny pillars that can isolate the circulating myeloma cells from the small samples of the blood. So the tiny diamond shape of the pillar are organized to allow the normal blood cells to grow through the filter while capturing the cancerous plasma cells. And they are not able to deform and squeeze between the pillar, so they get stuck in the filter. The system isolates the circulating myeloma cells based on their size and the mechanical properties rather than using the antibody labels to capture them. So the advantage of this label-free system is that it would be possible to safely extract the circulating myeloma cells after capture in order to study them further.
Our lab is also interested in breast cancer bone metastases. So it's the spread of breast cancer to bone site, and it appears in 85% of advanced breast cancer patients. So it's really severe because the symptoms include bone fracture or the reduced of survival rate. And our method are looking into how exercise regulate bone metastases. So there are cell type called osteocytes in bone microenvironment, which can sense the mechanical stimulation when we apply physical activities to bone. Yeah.
Within our device, we're currently starting to mimic what happens in our bone tissue. Within our bone tissue, the osteocytes embedded in your bone experience a different level of mechanical stress. And then these are communicated to the surface cells on your bone, which includes osteoclasts, osteocytes.